My name is Abbey Plawecki, and I'm going to talk about my poster titled Implementation of High-Intensity Stepping Training in Patients Post-Stroke in an Inpatient Rehabilitation Facility, a case series. So previous data suggests that interventions that attempt to maximize stepping practice at high cardiovascular intensities early on post-stroke may improve walking independence, speed, endurance, and may facilitate discharge to home instead of going to another facility. However, implementation of these strategies can be challenging early on post-stroke in inpatient rehab, as a lot of these patients present with significant motor deficits, cognitive deficits, and are more medically complicated. The purpose of this case series is to detail the feasibility and decision-making processes related to the delivery of high-intensity training in patients early post-stroke during inpatient rehab, as well as to describe specific facilitators used to overcome the barriers that we encountered. So we followed 4 individuals in inpatient rehab, and they were all within 3 months of having a stroke. Attempts to maximize stepping at high intensities were performed during regularly scheduled physical therapy sessions. We monitored their heart rates and their steps per day. Weekly outcomes included the 10-meter and 6-minute walk tests with level of assistance, the Berg balance scale, and FIM scores for mobility. Our intervention focused on targeting the 4 biomechanical subcomponents of gait, listed right next to the figure here. These components are propulsion, limb swing, stance control, and lateral stability. The figure shows the progression of the interventions used. So many of our patients in inpatient rehab start at the top of the blue line here, meaning they need a lot of assistance. At this point, we are providing the assistance, and then as they progress to more independence with the task, we start to add more challenges, make them make errors, shown with the red line. Some of these challenges include adding resistance, weights, decreasing upper extremity support, or walking in different directions. Then we talk about the 4 participants we have. 3 out of the 4 presented with a Berg score of less than 5, meaning they couldn't stand up yet. 1 patient presented with controversive pusher syndrome, and all 4 required at least moderate assist to ambulate. By discharge, all 4 patients had a clinically significant increase in their Berg scores and gait speed, and 3 of the 4 had a clinically significant increase on the 6-minute walk test. Signs of pusher syndrome had resolved in the 1 patient, and 3 of the 4 ended up going home. Figure 2 here shows how Berg scores increased as steps per day increased for this subject. So even though we weren't specifically targeting standing balance, it improved the more steps per day he took. Figure 3 shows heart rate and stepping rate for a subject during a high intensity session. And then figure 4 shows steps per day during high intensity stepping training for a subject. So that's the red line, compared to what we were doing before implementation with a patient of the same, that needed the same level of assistance. So their steps per day were down here, where after implementation, we were able to get those steps per day up. And then this table on the far right shows specific barriers encountered for each patient and how we overcame those barriers. So it was things like rearranging schedules to accommodate patient fatigue and family training schedules. We asked our OTs to take over transfer training so that our PTs could focus more on walking. When patients reported pain or discomfort, we adjusted harnesses, added padding, used bracing to protect joint integrity. And overall, we found that high-intensity stepping training is feasible in inpatient rehab and is tolerated by these patients early in their stroke recovery. We found significant gains in both walking and non-walking outcomes. And these gains were consistent with a published algorithm up here of predicted discharge disposition based on Berg balance scale scores. Thank you for your time.